Suicide has long posed a special risk for teens, but the problem has been getting more attention lately because of a series on Netflix, 13 Reasons Why. If Netflix meant to raise awareness about suicide and pressures on teenagers, the series has also raised concerns. These are concerns addressed locally by a leading provider of pediatric mental health services, Franciscan Children's in Brighton. We'd like to welcome its PhD and program director for the inpatient mental health program, Dr. Ralph Buonopane. Thank you very much for being with us, Doctor.
Glad to be with you.
First of all, whenever we have a suicide topic in the movies or on TV, it seems to me always to create this notion of the suicidal person, the person that I guess we stigmatize as being suicidal. How dangerous is that?
That's an important point. Suicide has so many different causes, and it's become the second leading cause of death for teenagers. So understanding it and really trying to cut into the things that create stigma and prevent people from getting help are very important.
Of course, in your work, when it unfortunately happens, suicide is the end point. What comes before that?
So in 90% of teenagers, there is some mental illness. And so it isn't something that just happens. I think unlike the depiction in the movie that really almost presents it as inevitable, because the movie starts with a completed suicide, there are signs leading up to it. And in most teenagers, though there may be a trigger that's a more current loss or a conflict, in most teenagers there's been depression, anxiety, maybe struggles with substance abuse that can be recognized earlier.
Well, this is a different story for every individual. In some communities, it's kids who are under pressure to succeed or to be glamorous. Mm-hmm. In other communities, you get kids growing up with violence, whether it's in the house or on the street. What about that problem?
Sure. Any adverse experiences like violence, domestic violence, parents, family members struggling with incarceration, those are all very significant stressors that increase depression, increase anxiety, and could potentially increase the risk of suicide. But the depression, the anxiety, those are treatable and preventable problems.
Well, another factor that we're probably seeing more of now is social media, the reputational factors, and then if you put in the mix some sexual assault. Talk about what that means for kids, high school age kids.
Sure, really, anything that increases impulsivity. Teenagers already don't have the ability sometimes to slow things down and think things through. And so we know that substance abuse is one of those things that just speeds up the impulsivity. But I think even nowadays, the cyberbullying, the speed at which social media works, sometimes is to the detriment of teenagers who really haven't developed the ability to think things through yet, slow things down when they're in crisis. And so it really plays into some of the things that are weaknesses for teenagers.
This is BNN News. We're talking with Dr. Ralph Buonopane from Franciscan Children's in Brighton. What about spotting the problems? Because yes, it'd be great if teenagers could take care of this themselves, but most of the time it's either other teens or adults who need to intervene in some way. What should they be looking for?
So it's important to recognize the warning signs, and a good thing about social media is often the warning signs and help can be much more available than they were before. If you look at social media sites that can be helpful with this. So the signs and symptoms, any conversation talking about suicide or death, wanting to die, should be taken very seriously, and parents should reach out, ask for help. But also signs of depression or anxiety, so withdrawing, talking about feeling like they're a burden to their friends or their family, being more isolated, less interested in things and people that had interested them before, agitation, not being able to sleep or sleeping too much, are all signs that are a good reason to then reach out for help. And there are lots of sources for help, be it school systems now. Many of the community mental health centers have outreach right in the school systems. that can be helpful. Pediatricians' offices now have very good mental health care integrated into the community mental health centers. And there are online screenings that you can take. The Franciscan Children's website has an online screening that a parent or a teenager might take. We have teenagers now who come to us who will say, I took an online screening and it said that I should be worried and reach out. So media can be helpful in that way.
It sounds like a tough thing for anybody to do at any age because, again, all of this stigma and then, you know, how do you get someone to cross that line and do it in a way that is constructive and say, okay, I have this problem, now I'm going to deal with it?
Yeah. You know, there's lots of models of understanding that reaching out for help is a sign of strength. And there's really been some progress in this. National Alliance for Mental Illness, Parent Professional Advocacy League, Youth Move International are all great sources of support groups and models of teenagers who've really made very courageous steps in sharing their stories and encouraging teenagers to reach out for help.
What kind of things do you do for teens once they're in your circle?
So Franciscan Children's, like a lot of community mental health centers, has a range of services that are really available to kids and to help identify mental illnesses, which are treatable. Depression responds to cognitive behavioral therapies and medication. There are treatments for anxiety that are very helpful. And there are programs to help with these in pediatricians' offices that reach out into the school systems. And if needed, there are hospital-based programs when there's an immediate crisis for kids that really bring all the resources to the child and family.
I know this can be very effective for people who have access to it, but these days we're going through a great amount of upheaval about access to health care. So what's it like for people who need this? Can people actually get this care? I'm not just talking about your provider, but generally.
Yeah. There are a lot of barriers to access, and that's really important. There was a school survey of Massachusetts students, and 1 in 10 talked about feeling like they were very depressed, and more than half of those kids said they had no help at all. So very important. I think some of the advocacy groups in Massachusetts, which are very strong, are important.
Oh, the Samaritans, of course.
The Samaritans, and even to just ensure that access to mental health care is part of health coverage.
Thank you very much for being with us.
Glad to be with you.
Still to come, the food gap in eastern Massachusetts. We'll hear about a new report from the Greater Boston Food Bank.